I am the facility manager at the Portsmouth Life Center. The Life Center itself, we do have 3 facilities, Portsmouth, Wheelersburg, and in Lucasville. And the Portsmouth Center is our main facility. It's our largest. We're right around 60,000 square feet of space.
How many people participate in
Between all 3 facilities, we're right around 5,000 members.
Wow, that's good.
Yeah.
And have you seen a change in the usage in the last few years?
Actually, probably about the last couple, maybe 2, maybe 3 years, usage has increased a bit. We've had some cancellations, which are mainly due to finances, but yet those people that did have memberships, we have noticed that they're using their memberships even more. So evidently the whole theory behind it's better to get fit and stay healthy as opposed to stay unfit and be unhealthy.
Are you, of the members that you have, are they age range? Are you seeing younger or older?
Our membership range is anywhere from 14 and older. I'd say our average age is probably right around 50, 55 or so.
And what about hospital employees? Do you see a lot of
hospital employees? I believe we're right around 500 to 600 SOMC employees are members.
So actually you're getting a broad participation from the community then.
Oh yeah, very, very large.
Yeah, excellent. Okay, we're going to talk about type 2 diabetes particularly. And so my first question is, when you hear the word diabetes, what do you think about? What comes to mind?
Well, first thing, just lack of blood sugar. I guess anything in specific or?
No, just whatever, it's kind of like just a word association. I'm trying to understand what people think when they hear that word.
I guess possibly overweight, insulin, lack of exercise, or unfit. Probably the first couple things that come to mind.
Do you have diabetes in your family?
My grandmother was a diabetic, and I do have a cousin which is type 1 diabetic.
Do you have worries for yourself? Any concerns for yourself?
Not so much. Not so much for me in particular. I do check my blood sugar levels at least every 6 months, and I've never had an issue with that. Personal activity-wise, I probably do the bare minimum to keep from stroking out sometime within the next couple of years, but that's just one thing I've never really paid much attention to, or I shouldn't say
but you're the fitness man.
Yeah.
Right.
Yeah. Just from my own personal.
Yeah.
I've honestly never been worried about becoming a diabetic.
And do you?
It's never been a driver for me.
So do you personally have an exercise program, activity program you do every day?
Here since May, every day, no. As I was mentioning to Sharon here a little bit ago, my wife and I had a water line break in the house, so we pretty much had to gut our entire basement. So for the last few months, I've been doing drywall, basically rebuilding my house.
That's a different kind of activity.
Yeah, that's a different kind of activity. So that's what I was doing right before I came here today, was working on that, and I'll probably end up doing it whenever I come back home after work tonight. So.
Yeah. Well, let's hope you can get that done and move on to something more fun, right?
Let's hope so.
But it'll be nice when it's all
Oh,
done.
definitely.
Definitely feel nice when it's done. But when you do a regular routine for yourself, what kinds of things do you do?
Typically, it's more cardio than anything.
Explain what that means.
Cardiovascular exercise is typically any exercise that a person can do for longer than 3 minutes. I guess clinical definition of it. Personally, we do offer some spinning classes at the Life Center, so I'll do those usually once, twice a week. I have a treadmill at home that I'll usually hit another 1 or 2 times a week, or possibly even stationary bikes or ellipticals. Work. I probably average well, other than lately, at least 3 to 4 days a week cardio. Resistance training wise, really haven't done anything really more than once or twice a week in several years.
And so on an average, how much time do you spend?
Cardio wise, I usually get about 45 minutes to an hour a day when I do it. Like I said, at least 4 days a week, 3-4 days a week minimum. Of course, usually during football season, I usually get a couple hours on the treadmills. I'm watching a game or something, but that's...
So you combine your watching
definitely
with some activity.
Well, I said before the great flood of Mother's Day, the treadmill was literally right in front of the big screen, so it made it very convenient.
So that's, which is a good idea compared to sitting on the couch,
Oh, definitely.
and just watching the game. You're actually getting a fair amount of activity then while you're watching. Does your wife like to do this too? Or?
She's pretty much the same boat. But she is a Portsmouth City school teacher, and since our schedules are totally different, she's usually at work by 7:30, quarter till 8. Gets home around 4:30. I'm not usually at work till 11 o'clock or noon, till 8 o'clock at night. So that time span after she gets off work, she'll usually go to one of the other facilities and do Zumba classes or some kind of group fitness.
You have children?
We do not have kids.
Okay, so that's not something else you have
No,
to put in the mix right yet.
But we do have an 18-month-old golden retriever that acts like a kid. So.
All right, there you go. What do you think causes diabetes?
I don't think, well, type 2. I think the biggest part of it is probably just lifestyle. Especially here with children, or just people in general, their activity levels have really dropped off. Just kind of going back to the whole school thing here with my wife, an example. She's a K through 3 teacher, and the kids are lucky to have gym maybe once, twice a week. I know when I was a kid, we had gym or recess 5 days a week. Kids aren't active anywhere near as much as what they used to. I remember when I was a kid, Mom would literally kick me outside and said, "Don't come home till the sun goes down. I don't want to see you anywhere near the house. I just cleaned it." And now if kids don't have a computer or a video game, something set up in the house, that's their main activities anymore.
In the folks that you see that come in and use the Life Center, what's bringing them there?
I think one of the biggest aspects of the Life Center is probably just the social dynamic of it. We have a lot of people that, as they kind of find their little niche, they kind of find the activities that they like, you kind of start to notice that they're talking to the same people every day, and if they don't show up, then the people they talk to are usually coming to me or one of my staff says, "Okay, have you seen Tom in a while? What's he up to? Is he okay?" So I think a big part of it is a big social component.
And the cost factor for people, is that a concern?
I think it's always a concern. I know our rates were basically $1 a day. Whereas I know the economy in this area is not exactly the best that it's ever been. So we have lost some memberships due to businesses leaving town, going under, or whatever. So that's always been a concern here for us. But as far as our current membership goes, we have started to notice within the last 2 years a Silver Sneakers program, which is insurance reimbursed. It's typically one of the Medicare add-ons will provide for that. We've seen a bigger influx of those participants using our facilities. I think we're right around 250, maybe 300 members with the Silver Sneakers program.
Do you offer scholarships of any kind?
Right now we do not. That's something that we had talked about, but unfortunately hasn't really gone anywhere.
Okay. Now, Tell me, I know you're doing something with diabetes, but before we get into that, do you see people coming in that do have diabetes?
Yes. And exact percentages, honestly, I couldn't tell you what percentage of our members are diabetics, but typically whenever somebody joins the Life Center for the first time, we ask them if they would like to have something we call a fitness consultation, where they could either sit down with me, one of my exercise physiologists, to review their medical history, set some goals, and then come up with a good, well-rounded exercise program based on all that.
Mm-hmm.
I would say less than 5 to 10% of our membership actually takes advantage of that. So typically the people that I see, some do mark that they are diabetic, some don't. The majority of them, even when I ask them, they say they've never had their blood sugars checked or their cholesterol's checked.
Mm-hmm. Do you see folks coming in that actually need significant weight loss, or are folks pretty much coming in there in pretty good condition?
I wouldn't say that. I'd say the majority of the people that I see they've never exercised before, or it's been 20 years, it's been since high school, they're turning 40 years old, or that 40-year window is right around the corner, mm-hmm. So they want to try to, I guess, I don't want to say get back to what they were in high school, but they're mm-hmm. That's when things start to hit home. Mm-hmm. Mm-hmm. So we get a lot of those.
All right. So then, tell me what you're doing specifically around diabetes.
As far as diabetes programming itself, we really don't offer any set programs for diabetics. As far as the hospital itself with the dietitians, I do know that they do diabetic counseling. I know there is a diabetic nurse educator that can see people, but as far as the Life Center, we don't have any quote-unquote diabetic type programs.
Mm-hmm. Do you ever see doctors, physicians giving health prescriptions, so rather than just medicine that they actually are saying?
Every once in a while we will. Unfortunately, insurance companies do not reimburse for that. So once we tell the person who brings a prescription in from their doctor that says so-and-so needs a regular exercise program, we tell them they have to pay for it, and it's not going to be reimbursed. We do not bill insurance companies that they tend to walk out without their membership.
Do you think the doctors don't realize that, or?
I don't think so. I mean, I don't think that was an issue. I think they probably, I would assume that they would understand that it's not going to be a reimbursed program or whatever. But do
you incorporate like a cardiac rehab?
In our building, we do offer cardiac rehab, pulmonary rehab, speech and hearing, physical therapy, occupational therapy. Pretty much everything's under one roof. Mm-hmm. Now, I can't speak for any of my other staff, but I have noticed when I've done fitness consultations with other on members that if something pops up, I have referred people to the cardiac rehab department, said, I think you need to have this looked at. I think this program might be a little better suited for you right now than a Life Center membership, and that's worked out pretty well. Mm-hmm.
Okay, now Sharon wanted you to come and particularly talk about some work that you're doing related to health promotion.
With youth in particular, over the last couple of years we have had a couple summer programs. One of them is Camp Life, which was a week-long program. I think we had 75 kids in the program, which was mainly a eat healthy, exercise right. It was an all-day program, 7-8 hours a day, where there was a dietitian involvement with that particular program. it was open to anybody in the community, not just Life Center members. That program seemed to work out pretty well. I had a pretty good response with it. We have a youth conditioning program which is targeted specifically at the 10 to 14-year-old age group. It's done pretty well in the past. It's kind of gone through several different transformations over the years. Currently, we model after the President's Challenge, where we're doing a lot of their fitness testing and measurements. But once again, we seem to keep getting the same 3-4 kids in the program. Usually once some of the other parents find out what the cost of the program is, or that there is a cost to the program, and then they tend not to opt to do it. So I think cost is a big factor for a lot of our youth programs.
Mm-hmm. So was there a charge for the program you had the 75 kids in? Was there a charge?
Yes, I believe that was $80 for the full week.
Okay.
And like I said, it included education material. I think all the kids got a T-shirt, which everybody loves a shirt.
So maybe some of the kids who are highest risks possibly couldn't.
I'm sure there were several that couldn't afford the program.
Yeah.
And they just opted out for that reason.
Do you think there's any opportunity to develop a program that could be offered free to in the community?
Oh, definitely. I think there's probably several different types of programs that we could offer if we had the manpower or had the financial resources for those. And I think one of the biggest hindrances would be just literally trying to get people from the surrounding areas in the community to come to a central location for that.
But one of the assets is that you do have these different locations, so that does lend itself to it.
It does help. We do offer programs at our satellite facilities in Lucasville and in Wheelersburg, but for whatever reason, people just will not drive even to those. So unless you pretty much park it in their backyard, I don't know if just people, they want it to be delivered to their home where it's more convenient as opposed to driving 5 or 10 minutes.
Well, and there may be other factors too that
I'm sure.
That we're not necessarily considering. The problem of inactivity, physical inactivity, and overweight are pressing problems on our communities right now. What would you suggest as a way to address that problem if you couldn't be a member of the Life Center?
Sorry.
It's okay.
Ideally, I've mentioned this to other people out in the community when I've talked to Rotary groups or whatever. Literally, give me a call, or probably better yet, just talk to your healthcare professional, whether it's your primary care physician. Just touch base with them and see if they would have any referrals to anybody in the area that might be knowledgeable on the subject. One of the nice things about the Life Center is we're pretty much middle of the county. We're in the middle of our service area, and we do have a lot of good resources for folks. The hard part is just for those folks that really don't have a clue that, the Life Center, that we're still here. We've been in the community since 1986, and there are people that don't even realize the building is where it is, and we offer what we offer. So trying to get the word out, that's difficult.
Yeah, it's kind of interesting sometimes that you just think everybody would know, but they don't necessarily. Right. Maybe we could kind of end this with you just kind of talking a little bit about the benefits you see in getting active. You know, whether it means coming to the Life Center or just getting physically active in the community. What kinds of things might you suggest about that?
Working in cardiac rehab, I'll kind of use that as an example because I think it fits. That several years ago, we had an older lady, 70, 75-ish. Husband was deceased, passed away several years ago. Children lived in Cleveland and out of state. She came into cardiac rehab after her heart attack, and you could tell that she always dressed very nicely, but you could tell her heart just wasn't into going anywhere, being sociable or anything. So working with her over the course of it was a 12-week program. About 6 weeks into it, we started getting a little closer to Thanksgiving, and me and my staff, we kept asking her, all right, Betty, what are you going to do for Thanksgiving? Are you going anywhere? Are you doing anything? It's like, well, my daughter wants me to come to Cleveland. My son wants me to go to Virginia. I really don't feel like driving anywhere. I think I'm just going to stay home. As we got a little closer to Thanksgiving, you could tell that she started to come out of it a little bit, because in cardiac rehab, we always had a real nice, light atmosphere, like to joke around and play around with everybody. And you could tell she started to come out of it a little bit, where she started wearing more makeup and dressing up a little better, and her spirits kind of came back. Well, once we got a little closer to Thanksgiving, you could tell she was a little bit more enthusiastic about it. She's like, well, I know I'm not going there because I'm not driving that far. Not only that, but I have I have a lunch and I have a dinner that I think I might be going to, so she went there. Plus, she started, toward the end of her cardiac rehab, she started missing sessions because that's when her bridge club started to meet. So it was a very nice transformation, with the socialization aspect of it, with the exercise part of things. It got her energy, her motivation back, and it was really kind of fun. You'd see a 110-pound, 5'4" lady driving a big old Cadillac Brougham down the streets, just moving along. So it's kind of nice to see stuff like that.
So being physically active can help your mental health and
definitely.
your social health
Yes.
as well.
And we've had members that come in and take Zumba classes, one of our group fitness classes, and literally lose 100 pounds. We've had people that have never jogged a day in their life and that are running 10Ks, half marathons now, and it's very nice. That aspect of the job is wonderful. I mean, that's pretty much what we live for.
Excellent. That was very nice illustration, I think. I think I've asked you all the questions that I really have. Is there anything else you would like to add?
I don't think so. Other than if anybody does have any questions about the Life Center or services that we might offer, just give us a call. 740-356-7650.
There you go.